Hello, I'm Dr. Arjun Handa, plastic surgeon and body contouring expert at Handa Aesthetics and Plastics. Patients often want to differentiate between breast implants and breast fat grafting when they want to go for breast augmentation. There is a lot of confusion in their minds regarding the two procedures, and it's very difficult for them to make a decision as to which procedure will be best for them. In this video, I am going to answer some questions pertaining to breast implants and breast fat grafting, which can make the decision a little bit easier for the patient. When we talk about breast augmentation, two procedures come into mind: augmentation with implants and augmentation with fat grafting. There are certain factors which are taken into consideration, which we explain to the patient in deciding between these two options. The first one is, what size do you want to achieve? If the size of the augmented breast has to be only 1 cup size larger than the present breast size, then breast fat grafting is a good option. But even then, it may require sessions and one procedure might not be enough. On the other hand, if the size required is more than 1 cup size than the present breast, fat grafting cannot achieve this. Implants are the only option. So this is the first question that I ask the patients: what result do you want? If the result is more than 1 cup size, then fat grafting cannot be an option and all the other points do not matter. On the other hand, if only 1 cup size is required, then we can talk which one is best for them. Second question comes regarding the question of scar. If the patient doesn't want any scar, then breast fat grafting is a better option, because in that procedure we are going to take fat from the tummy, thigh and lower back via small incisions which are hardly visible. And then we are going to process the fat and inject it into the breast, again creating no scar. But if we are going ahead with breast augmentation with the implants, then there is going to be a scar either in the breast fold or in the axilla. Either way, a scar is going to be there. Normally, nobody can see the scar. Normally, the scar is so small and it fades away with around 6 months after the procedure. But even then, some patients are very troubled about the scar, and fat grafting is usually a better option for them. Next comes the question of natural versus not natural. If the patient doesn't want any foreign body inside their breast, then fat grafting is a better option, because we are using the body's native tissue to increase the size of the breast. On the other hand, in case of breast implants, we are going to put a foreign body which may be unacceptable to some patients. Finally, there is the question of a need for second operation. In breast fat grafting, a second procedure is highly likely, because one session of fat grafting is usually not enough to achieve the required size. In the case of breast implants, we just choose the right size of the implant and place it in the patient's body, and then the patient has the final result at the end of the procedure, and there is no need for a second revisionary procedure. So these are some of the factors that patient has to take into account before deciding between the two procedures. The most important being, what is it that they want? If the increase in size is going to be a huge amount, or let's say more than 1 cup size, then breast fat grafting is simply not an option. If the size required is smaller than that, but they do not want a revision procedure, again breast implants are a better option. If they do not have any problem with the scar or a foreign body, then again breast implants is a better option, because a second procedure is not required. Thank you for watching this video. If you have any questions, please mention them in the comment section. Please like our video and subscribe to our channel.